Hi, I'm Eric McEwen from the Science of Hearing Group. I'm here today with Delia Clouthier, audiologist and owner of Barrhaven Hearing Clinic. How are you, Delia?
Hi, Eric. I'm good.
Delia, you spent many years working in one of the largest hospitals in Eastern Ontario as an audiologist. Now you own your own clinic. You've practically seen it all. Many people today, though, are worried about getting a hearing test. Is there anything you can tell them about the process?
A hearing test is a very simple procedure. It's non-invasive, there's no pain involved, you don't even require a referral. You can call the clinic yourself and make an appointment.
When somebody arrives at your office, what can they expect?
First thing when they come in, we do take a case history just to get a little bit of information on the patient. We do look in their ear. We look in the outer ear to make sure that there's nothing obstructing the ear like any earwax. Next, we do a test to check the middle ear. That's where the eardrum and the middle ear bones are. We do a little pressure test to make sure there's no infection, no fluid, no perforation in the eardrum. Next, we put the patient into a sound booth because we want to have the ideal situation. They are presented with tones. They start at an audible level and they slowly get softer until we can find out what the softest sound is that individual can hear across those different tones. Next, we do something called word discrimination. We say words and we ask the patient to repeat them back to us because we want to test the integrity of the brain to understand those tones and transfer them into words. You
mentioned the brain. Can you clarify again the role the brain plays in the hearing process?
The brain is the most important part. The ear is an avenue. It collects sounds. It transfers it through the ear, through the auditory nerve, up to the brain, and the brain tells you what you're hearing. For example, the ear will hear a bell, but it's the brain that tells you if it's the door or the phone. So it's important to continually stimulate the brain to make sure we have good cognitive function.
So Delia, if you had one message for somebody watching this video, what would it be?
Simple, get a hearing test. Doesn't matter if you have a hearing loss or not. I think it's important to come in, establish a baseline and find out where you are. And if there is a hearing loss, then we can sit down and talk about what our options are.
That was really helpful. Thanks for coming in to talk to us today.
Thank you.